Well, thank you again, everybody, for joining us here today. We are really fortunate to have the CEO of ClearData, Darren Brannon, joining us to talk a little bit about the cloud technology storage area and how to better manage and utilize data, which is obviously the currency of innovation in healthcare and life sciences today. ClearData is at the core of that model, and they are helping healthcare organizations all around the world transform and innovate the multi-cloud world. It's a lot, but it's important. And their expertise runs not just in the cloud, but also within the healthcare cloud, life science cloud. So HIPAA, GXP, GDPR, all of the critical components of running a cloud in this new digital healthcare world that we're working in post-COVID healthcare system. And it's built for things like cloud management and security, compliance and remediation. ClearData is helping organizations focus on patient care and innovation, not the technology infrastructure that can bog organizations down that are trying to enable these sorts of things. So Darren, thank you very much for joining us today.
Thanks for having me.
So if you could just give us a little bit of background on yourself and ClearData.
Certainly. I'm a product of, I guess, the Silicon Valley. I've been in the venture capital and tech ecosystem for the last almost 30 years, and have been a serial entrepreneur for the last about 20 years. And this ClearData has been a terrific opportunity to combine the Silicon Valley tech startup world into driving innovation into health tech. And ClearData is, given it is in healthcare, we are very much a purpose-driven company. Our mission and our passion is to make healthcare better every single day. Our purpose on that passion is really to tackle the third largest health crisis in the US. Most of my family are physicians, or they run physician offices, and they see it firsthand, and I convey it to my team as often as I can to remind them that, sadly and unnecessarily, medical errors kill roughly 1,200 people per day. At the heart of this staggering statistic is 10 to 20-year-old technologies and lack of data flow and 50-year-old processes, still very pervasive throughout the healthcare systems. So we really hope to reduce this death toll by executing on our vision to become one of the world's most innovative companies designed to modernize and protect healthcare IT. And we're really executing that vision by deploying our healthcare cloud management, cybersecurity, privacy platform, and data services platform, significantly modernizing and operationalizing the very foundation of healthcare IT to be more scalable, reliable, high performing, and really ultra secure and compliant. And that IT kind of infrastructure and data overhaul, if done right throughout the healthcare organizations, helps unleash IT innovation at point of care, allowing for that greater flow of management and patient data, driving more critical decision support systems, and with capabilities like AI and ML. And so if we can do this, if we can help healthcare organizations move from old on-premise, kind of fragmented, broken IT infrastructure and data to more secure, modernized public cloud environments, that multi-cloud environment, will significantly transform healthcare data and application models. And I think, no doubt, will directly be responsible for saving many lives to be a major force towards resolving the number 3 health crisis in the US today. So that's a little bit of a preamble on ClearData, myself, and our mission and purpose.
No, those are great examples, and certainly do highlight the need of having not just a cloud storage provider, but having the kind of sophisticated platform that your team provides. Maybe you could walk us through some of these examples of how some of America's top institutions have been, and even some startups, have been able to utilize ClearData toward these ends.
Yes, I think it's important to highlight some of the pain points that healthcare IT professionals, they know they're sitting on sort of old, fragmented infrastructure, wildly underinvested in cybersecurity and compliance. And again, these two things are contributing to as many as 12 million material misdiagnoses a year. And if it was easy to fix, it would already be fixed by now, because the impact of this lack of advanced technology is so critical. Again, a number 3 health crisis in the country today, medical errors. But it's a non-trivial problem. And there's 3 major pain points, and I'll talk about a couple of use cases here that really inhibit the progress that should have happened over a decade ago with 10, 20-year-old technology and processes. And we really designed our business around solving these 3 industry roadblocks. The first is really this talent gap to complete this data and infrastructure overhaul work. You need secure cloud IT environments, and that requires certified experts, not only in the 3 mega public clouds, but also in the cyber domain and the compliance domains. And many healthcare organizations, they just can't attract and retain these specialists. They prefer, to work in kind of cool health tech companies like ClearData versus maybe working in the basement of a hospital. And so that's one of the biggest challenges, is having that access to that kind of talent sophistication. The next one is really then having this sort of born in the healthcare technology platform and services approach that acts as the glue to really assemble, automate, remediate, and operationalize the thousands of moving parts that need to work harmoniously together to create this new modernized, secure technology infrastructure data management environment in this highly regulated industry. And the third major challenge for many healthcare organizations across the spectrum is to find a technology partner like ClearData that is really 100% focused on healthcare only, that knows the regulations, local, state, national, even international, and that can interpret the NIST, GDPR, GxPA, HIPAA, interpret that into technology opinionation, then codify that into a platform that creates the necessary kind of content, IP intelligence for establishing the technology safeguards needed to automate and continuously remediate the cloud environments, leading to that modernized and protected healthcare IT environment that allows for more accessibility and flow of data. And so a couple of organizations, so those are kind of the big challenges in the market and why healthcare organizations end up seeking out companies like ClearData. A good example of that is a major payer, one of the Blues, Blue Cross Blue Shield Mass. Their use case was they needed to accelerate their journey to the cloud in a secure, compliant, sustainable way for all the irrefutable benefits that are in the cloud. Like many payers, they really needed to leverage their data to provide personalized care for their roughly 3 million members. And their challenges and pain points specifically was that their data was siloed in legacy environments across 20 distributed business units, making it very difficult to access and use. And so kind of our solution results approach was our healthcare multi-cloud security and compliance platform and services were deployed. We consolidated their data environments. We allowed modern tooling in the cloud to innovate securely at scale with this kind of new digital footprint, enterprise analytics, runtime engines, machine learning, things they couldn't use pervasively. With that upgrade, that modernization and protection of their data, we helped shift their data culture to greater cross-functional collaboration and data-driven making decision-oriented approach. So that was a terrific set of outcomes. We have other payers like that. And I'll just mention one other use case because I think it's important. There's a lot of startups, over 5,000 health tech startups, many of which don't come from healthcare. They're not familiar with the regs of high trust and NIST and HIPAA. And so InfoBionic is a great example of a leading venture-backed digital health company providing cardiac patient monitoring diagnostic services to physicians and their patients. And their needs, they have a collection of cloud-based and sensitive data. They need airtight security compliance and cloud operational capabilities. They sought out us to provide this direct access in partnership with the mega public cloud, and then all the automated safeguards, remediation, and peace of mind, knowing that they have a high trust cloud management approach. The pain points that they saw were, many. They're early stage medical device innovator. Really they lacked the internal expertise and resources to leverage the advanced technologies in that secure, compliant manner around public cloud, because that's not their core competency. So we allowed, through this partnership, allowed them to work directly with AWS, and ultimately they were able to just focus on their core competency of continuous innovation around their medical device technology and trusting the management cloud data and security services that we provide. So those are just a couple of, I think, primary examples of what we're seeing in the market.
Yeah, I think that's incredible. And I think that does illustrate the depth and the scale that healthcare institutions today need to have a more complex platform when it comes to cloud-based activities. And so, this is changing. We know this is changing dramatically. We've seen what's happened around the world, especially in the US, with security breaches and things like that. How is ClearData addressing this rapidly evolving IT landscape from threats and all these other different areas, both from a technological and a regulatory perspective?
Yeah, I come from, as a venture capitalist, you trained almost as a market analyst. And in the history of my 30-year career in IT, which is high technology obsolescence, I haven't seen a more rapid, innovative industry category. In healthcare, in the last 9-10 years that I've been in this innovation super cycle, nearly everything is on the table for reinvention, reimagination. And so it's been tough, even as a venture-backed tech company where we're trained to be very nimble and fast. I've had to kind of break it up into 3 ways of staying on top of the market with a multifaceted view. So our primary focus is kind of the near-term focus. What must we do over the next couple of quarters? So we run a continuous pragmatic product marketing organization, which means we really focus on that next 90 days, review multiple sources to create kind of backlog of features aligned with the current state and demands of the market, from analyst info, customer prospect, feedback, lost leads, close one, existing customer intel. We constantly are synthesizing that information to create the right kind of feature build out. And then for more medium range planning, we drive this rigorous semi-annual kind of strategic planning process with the full SWOT analysis, thematic goals, Rockefeller strategic planning process, in conjunction with, almost in parallel, our regulatory CISO, CPO. They're thought leaders in the industry, and they're conducting quarterly trend analysis, very detailed quarterly trend analysis, and sharing that with our staff and our board. And so the combination of those allow us to have some mid-range planning. And then the long-range planning is just, we've got a wonderful chief strategy officer. He's a leading ex-healthcare strategist for the past 20 years at places like Accenture. And he just, works with us to do that 3 to 5 year, where are medium bets, where are the big bets, and then continue to be agile. And then we seek out partners like Persistent to share notes and collaborate on how to drive our mission forward together, building market share and really driving to where the regulatory puck is going and where the innovation puck is going.
That's fantastic. And it sounds like you guys are busy trying to keep an eye on where the puck is going, which makes a ton of sense given the fact that it is evolving so fast. Tell us about where ClearData is going in the future. Obviously, you guys are ahead of the curve on this stuff. What does the future look like right now for ClearData?
Yeah, we used to, in the first 10 years, it was almost like a crystal ball in healthcare, because you could see wonderful technologies that worked really well, and healthcare is 10 years behind. Now, healthcare has been catching up quickly, and so now, it's more of that near to medium range planning, and where we see still big challenges and pain points are that access to the data, creating secure, compliant access to data, I think, is still a major focus for investors, is major focus for the healthcare organizations. And it's non-trivial, because you just have metadata siloed environments that have old ways of sharing that data, and they need to almost be untrained and then reinstalled, new technology, and then, almost running it for them. So once you can solve that data challenge, and having come from healthcare practitioners, even my stepdad, who just retired less than 12 months ago, says that healthcare is less of a science problem than it is a data problem these days. Healthcare knowledge is doubling nearly every 7 months, and so there's just no cognitive way to stay up on that. They need the data at point of care, and they need organizations like Persistent, ClearData, to help pave the way to get to the data.
Brilliant. Well, look, Darren, always great talking to you. Thank you so much for joining us here today, and looking forward to seeing just incredible things happening with ClearData in the future. Thank you very much for joining us.
Thank you for having me. Enjoyed it.